David Duffner, MD, orthopedic surgeon, Desert Regional Medical Center, specializing in spinal surgery, joint replacement, reconstructive surgery, and arthritis.
Well, for 15 years, I did level 1 trauma when I was in practice in Texas, and I learned to do pelvic fractures. And that's something that most orthopedic surgeons don't do, and I find to be quite fascinating. At first it was intimidating, but it's like anything else. Once you learn how to do it, it's not all that difficult, although some of them can be quite challenging, but I find that to be that they are very, very interesting cases to manage. Basically, a hip replacement is usually done for arthritis. Different types of arthritis, but usually the joint is worn out is the basic problem, and it's very painful, sometimes very stiff, and in all cases very painful and difficult to walk. So we replace the ball in the socket. The newer techniques, it's still replacing the ball in the socket, but the newer techniques have to do with less invasive surgery, so we have smaller incisions, and the operation itself, the replacement of the ball in the socket, hasn't changed that much, but it's just the way we do it. So it's smaller incisions, less invasive surgery, so there's less damage to the muscles. That means less pain after surgery, quicker recovery. And then the other big improvement is improvement in the materials that we use, the metal components and the plastic components, and in certain situations we use other materials such as ceramics, and the improvement in the actual implants themselves has allowed us to extend our indications to younger people. Whereas in the past we used to say, you know, you should be in your 70s or at least your 60s to consider a hip replacement. Now we can extend those indications into younger populations, into the 50s or even the 40s, if their problem is bad enough. Now, I'm not suggesting that a hip replacement is the answer for everybody with a painful hip, because number one, you've got to have the right diagnosis. Number two, you've got to be sure that you've tried all of the other non-surgical options. And number three, you've got to be sure that you can get through the rehab, that you're healthy enough for the operation and that sort of thing.